To learn more about these handling methods, let's start with Lauren. In any evaluation or treatment, start with a good base of support. Both feet flat on the floor and sitting upright out of a posterior pelvic tilt.
If anything hurts at all, you tell me, okay? Because I don't want it to hurt, and I always say that. So even if you think it might start to hurt, you tell me and we'll stop. Okay. Deal? Deal. Okay. Because you've had a painful shoulder and you don't want to have it hurt again.
I always tell my patient to let me know if at any time there is any pain or discomfort. Observe from the front and from the back.
That's pretty easy to see. And even if I just ever so slightly, that doesn't hurt. No. Push the head of the humerus up, we can see that.
We see that Lauren has a subluxation, which isn't a problem as long as we make sure the structures are gliding. As we look at Lauren from the back, it's easy to see the asymmetry. Notice how the medial border of the left scapula is more pronounced than the right. Also, notice the position of the scapula as it rests on the thoracic wall. If we measure the distance from the vertebral column to the medial border on her right side and compare it to the distance on the left, we can see clearly that her left scapula is in retraction. If you look closely at the spine of the scapula and compare the two, you can also see that the left scapula is in downward rotation. Remember, protecting the shoulder does not mean immobilizing it. The combination of muscle weakness and increased tone causes imbalance and poor alignment of the shoulder structures, putting them at risk for injury. The scapula has 3 planes of motion: elevation and depression, protraction and retraction, upward rotation and downward rotation. Most functional movements are a combination of these 3 planes of motion.